Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care. Hosted by Dr. Char.
Hello. Today we are going to have with us a casual conversation, two leading leaders in the podiatry space. Dr. Yerusalem Lanier is a founder and provider of foot care in Tennessee. And Dr. Curtis Ramkhelawan, he's also a board certified podiatrist, and he's in New York City. And while Dr. Ramkhelawan cares about children and education, and Dr. Lanier has a great interest in supporting other podiatrists, both of these precious professionals care about the well-being of each of their patients who deal with diabetes, their toes, their nerves, if they're feeling pain, and if they're not. Welcome, guys, to this podcast. I appreciate it so much.
Well, thank you, Dr. Char, for having me.
Same. Thank you so much for for creating this place for us to talk about diabetes and our patients.
Well, it's a joy. It's a real joy for me. I want to begin by, when I say it's a casual conversation, we spend so much time as patients just coming in and quickly getting our need met and moving on. And I don't think that's an intent at all, but sometimes not having enough time to get acquainted or hear it casually. I'm hoping this space makes good for that. Now, I have patients probably in my office longer than either of you guys do at a time, and still there's room for this kind of conversation. So what I'd like to do is to get started by each of you sharing with how in the world you got started in foot care, of all things. Can you tell us, Dr. Lanier, first?
Sure. For me, it was just by a fluke. I did not know podiatry was a different entity. I thought, you go to medical school and you specialize in podiatry. I didn't know it's a different avenue. So I went to Fisk University. It's an HBCU school here in Nashville, Tennessee. My last year at Fisk, there is a podiatry school on Kent State. They came to the school to talk to us about what podiatry is and what they offer. And I was surprised by, so you have to go to a different school to be a podiatrist. And I like their anatomy lab. So I decided to go visit. When I went and visited, they took us to one of their hospitals and we shadowed, and I like the age population the podiatrists were seeing. They were age population, older people. They reminded me of my parents. And I said, well, this is something that I can look into. So as I finished my last year of college, I shadowed a few podiatrists here in Tennessee, and I just loved it. You're not going to kill a patient. Well, you can, but it's not as urgent it's not an emergent situation where you have to worry, you have to be on call all the time. If you want to have a family that normal 8 to 5 job, you can do that with podiatry. That's how I was introduced to it.
What about you, Dr. Ramkhelawan?
Well, my story is similar to one extent in that I didn't know that podiatry was a separate entity. I think in my early 30s, I got up one morning and I couldn't move my foot. And I was thinking, who beat me during the night? And I literally suffered for about 6 months until somebody pointed me towards a podiatrist. And at the time I was in college and working in retail. And so I was on my feet constantly, and I really couldn't find help in any other avenue. And so I finally saw a podiatrist. And, after one visit, what I suffered with in 6 months, I was able to walk out pain-free for the first time. Wow. And that was in the back of my mind. But, my wife and I were youth pastors in Texas at the time. For whatever reason, God had me do an in-depth study in humility. And the one thing about humility is Jesus's example when he washed the disciples' feet. And so it wasn't something that I rushed after. I was just thinking, all right, God showed us humility by taking care of washing someone's foot. But I did try to get into mainstream med school. and all of those avenues. And, when I was actually going through all of that, I thought, oh, Lord, I thought you told me to do this, but no door seemed to open. And then God directed my wife and I to New York. And when that happened, he opened the door to the New York College of Podiatric Medicine to me. And I got in. I was able enough to be awarded a scholarship for the first year. And that's how I got in. And it's been a very rewarding career. And just like Dr. Lanier said, it's a field of medicine that allows us to still have a life. And for me, my life outside of this is ministry. So it's been great to be able to do ministry and medicine.
That's awesome. You guys both have amazing stories. I didn't know this, but moderately active humans will take more than 200 million steps and walk more than 110,000 miles in a lifetime, more if you do sports and exercise regularly. I also read that would take us one halfway to the moon, or it would take us 4 times around the planet. It would take 8 years to put that many miles on an automobile. Are you kidding me? So does every patient with diabetes, my question is, do you need a podiatrist on your medical team? I know it's setting you up, and I know the answer, and everybody else knows the answer, but do we need a podiatrist on your medical team if you have diabetes? What if you're healthy? What if you're young? What if you have no issues? Now, if you're going to walk that many steps, does it keep you from being sick? Speak to that a little bit. Would you do that?
Well, what I've seen and what I know is that, yes, I do believe that every single patient, whether or not they're young and healthy, or whether or not they're old and healthy, do require a podiatrist on their team. Now, what may vary is how often they see a podiatrist. So for some of my younger or even my older, healthier patients, I only see them once a year. And if they have any issues, they know they can call me at any time and schedule to come in. But then on the other spectrum, I have patients that I literally see every week because they have ulcers, long chronic standing ulcers that require debridement, require treatment, require antibiotics. And so it really does vary. Now, in terms of the more you walk, I believe that movement is our friend. It's not just for the diabetic population, but for people who have a history of arthritis of any kind. Or, I do believe that movement is really what keeps us going. The problem, though, is that most of the times it becomes a mental battle. When we feel pain, we just want to stop. And the problem with the human body is once we stop, it becomes even more difficult to get going again. So, I guess the short answer is absolutely. I think it's critical to have a podiatrist on your team.
Well, but Dr. Lanier, we know that's the truth. I don't think a patient would actually deny it, but if it's true, why does podiatry seem to be such a secret? Not that we don't get told there is one, but there are a lot of patients that I happen to work with in another area, but have never seen a podiatrist. Have you found that common? And why is it not as widespread maybe as it should be? Or is that a fair question?
That is a fair question. It's because it's a specialty. It's not like a primary care physician. They have to go see once a year or once every 6 months. All diabetics, they should see a podiatrist for sure, because there are things that, your primary care physician would not pick up. Several things on the feet, podiatrist can pick up, can follow through. I don't understand why. I don't know why patients in general, they don't know what podiatry is. I think it's getting better. Before it was not a specialty where it was known. Now it's getting better. There's a lot of podiatrists out there. There's only 10 podiatry schools, so there were not a lot of podiatrists out there. But now that and there was not a lot of residencies for podiatrists, so I don't think there were a lot of podiatrists to begin with, but now I think because of the schools, because of the residencies being available to all podiatrists, there are podiatrists, so we'll hear more patients knowing about what podiatry is and wanting to go see a podiatrist.
Good.
Yeah.
Because in my field, in mental health, it was one of those things that has been on the sideline until recently. It's popular now. It's in vogue to go get mental health help now, but for so long it wasn't. I don't think that's the same reason with podiatry, but for the most part of my almost 49 years of dealing with diabetes, I knew there were podiatrists around. I knew that if I needed help, I would go to one, but I can honestly say I didn't have an understanding that was for me personally, that was a regular routine that I should be in until recent years. So I'm glad that knowledge is getting out there. But as well, what I'm hearing you say is that even healthy, once they get diagnosed, it would be good wisdom for any patient to go on and just schedule an appointment with a podiatrist in order to build that relationship, that rapport, and then be checked. I think I heard one of you say once a year minimum, right?
Correct.
And more as needed.
Oh, absolutely. I think to address that question in terms of why podiatry seems secretive, I think for most of the older medical professionals, and I don't mean that disrespectfully, but for those that have been practicing medicine for 30 plus years, podiatry we weren't medically recognized. I think in the last 20 years or so, that is what made the difference in terms of not just the medical schools for podiatry, but the residency programs, and the fact that most residency programs are surgical residencies. So there's no a kind of mutual respect that's being developed in the world of medicine with orthopedic and podiatry, as well as with the primary care physicians, and in fact, all specialties, because now there is the referral system where we know if we see somebody that has a neurological issue, we send them to neurology, right? Likewise, if we suspect that there may be a vascular issue, we send them to a vascular specialist. In the same way, I think more and more now, especially in the primary care world, they are beginning to recommend or refer their patients to podiatry, especially newly diagnosed or even patients that have been diagnosed with diabetes for a while, but have not pursued good foot health.
Yeah, to add to that, Dr. Curtis, referral system here in Tennessee for diabetics, it has been, straightforward for me as a new practitioner. I have been out of residency 2 years now. I see them, I work at a hospital. I have a lot of primary care physicians near me. So I see the referral system comes. Once they are diagnosed, they send them to podiatry right away. And I'm appreciative of that referral system.
Yes.
But I know it has changed. I know it wasn't this way for a long time.
It's important that it changes. Just some time back, I had an issue with my foot, and I finally went to a podiatrist. And the podiatrist said that I had an ingrown toenail. And I said, oh, no. I have been somewhere. I've been to see a tech, and I don't have an ingrown toenail. And my podiatrist quickly said, I've been to school 12 years. Let me decide if you have an ingrown toenail. And I'm like, okay. So if we can just get people to recognize, and I know we are now, it's not like I'm talking like we're back 10 years ago, but if we can get more and more people to recognize the value of it. It only took me one appointment, and I'd only been to a podiatrist. Now, I've been with diabetes now almost 50 years. I'd only been to one podiatrist, and he said, "You have healthy, good feet, wonderful feet," until I had this issue with my toe. And it only took one time for that relationship to build, for me to know I won't neglect that again. I will let the professional take care of the needs there. And so with that, I'm going to segue over to my side of the game. When those patients come in there, how many experience anxiety, and how many of those do you guys refer to specialists, or how many people do you see with anxiety, and how many of those are seeking joy instead of anxiety? I believe joy is our birthright, and I believe anxiety is not something we have to manage. But I don't know how many of my brothers and sisters in the field are doing the referrals the other direction. What do you think about anxiety, and how does that play out in your arena? Either one of you.
Well, I think for the most part, there's always going to be some kind of anxiety when a patient comes in. First of all, the feet are probably the most abused and neglected part of the body. Most of us don't even think about our feet, except if somebody says that your toenails are too long and you need to cut them, or something like that. So when patients come in, especially patients that are familiar with diabetes, either having it themselves or knowing people who have had diabetes, especially if they've had family members who've lost body parts,
Yes.
toes, their feet, their legs, the anxiety levels are very high in those patients. And then you have patients who are generally anxious about every single thing. So they come in thinking, I'm going to lose my toe, when, just like you, Dr. Char, all they have is a simple ingrown toenail, not anything significant. But in terms of trying to get them directed to the right kind of help, I think one of the things that I try to do is I don't rush my patients in and out. I think for me, it's more important that they understand what it is that they're dealing with. Mm-hmm. Because the truth is, I have found, it may be different for other physicians, but for me, I've found that most of my diabetic patients don't have a clue as to what their disease really means. Mm-hmm. They were told by some primary care that they have diabetes because of some blood test. They were put on medications, and then eventually they find their way to me. It's not always initially, or you have diabetes, maybe you should go see a foot doctor now. It's usually there's something wrong. Mm-hmm. They'll see discoloration of the nails, they'll see discoloration of their feet, they'll be suspicious because of some friend or family that just recently lost a toe, or you get what I'm saying?
I agree.
And so that's what brings them in. So they come in with a heightened sense of anxiety because they really don't know. And sometimes it's really just about spending the right amount of time, because we never have all the time that we really want to just trying to explain to them what it is that's going on, what diabetes really is. For the most part, diabetes is a small vessel disease. It affects very tiny blood vessels. And as a result of that, you can have microvascular issues as well as macrovascular issues. And so that is something that a lot of patients don't understand. So first of all, is trying to get them to recognize, yes, they have diabetes, but it's not a death sentence. And to calm them down as best as I can. And when the need arises, being part involved in ministry, it's kind of very difficult for me sometimes, because I really do want to bring Jesus into everything. And I do get that opportunity every once in a while, because I'm bound not to bring that subject up. Unfortunately, in the way that New York law reads, I can't bring that in all the time. But if a patient were to ask me, then I can. But I always try to get them to understand that peace really is where they need to find. You know, peace is what God wants for us. He promises us peace in the midst of storms. He promises us that he can calm any storm. And so whether it's talking to a professional like yourself, Dr. Char, or even talking to someone like me who can just direct them to in terms of what they're taking, why they're taking it, what it's supposed to do, what are the side effects, that makes a big difference in their lives.
Dr. Lanier?
You know, he did a great job explaining anxiety, but I want to talk about mental health in general. We have a lot of patients that come in and you know, they're walking on a foot that has been smelly, you know, they have ulcer. The ulcer has been there for weeks. They don't know what's going on, and you take the shoes off, you know, the toe is about to fall off, and they have no idea. And I always wonder, don't you smell it? You know, they were like, yeah, the reason why I'm here, my wife told me, you know, there's smell coming from my foot, because they can't feel, you know, their feet. They don't take care of it. And I always think about, this is not just because they can't feel it. There's something to do with mental health. Mm-hmm. I'm sure, you know, those are the patients who I like to consult psych when they are in the hospital, because no one should live like that, right? So it's not anxiety. Sometimes it's good because you know they're worried, you know they want to take care of it, you know they feel like they're going to lose the foot. But you have the other spectrum where they don't know what's happening, and their foot is falling off, and their life is crumbling, but they have no idea.
So. I was downtown last week. Oh, shoot. No, that was just Monday. My week's been busy. I was downtown working with a group with the homeless. And one of the homeless men told my husband, who was discussing with him how he could find his way home. He wanted to be where his family was, and he was trying to locate the group that would help him do that. And the man said of his plight, and then he said, I just got comfortable here. I just got comfortable living like this. And so there's a learned helplessness in the cases that you just described, of people that if they don't feel it, mm-hmm. It's just sad that we can go 30 years before we feel the pain attached. And then by then, sometimes the feeling is not there that will guide us to it at times. But I love to teach people stress. We are created. We're made to handle an emergency, mm-hmm. like grab a kid from in front of a car in the street. But when that emergency is over, it's our privilege, responsibility, and obligation to pull our emotions back into place and not carry stress that leads to anxiety. So we don't have to carry anxiety, but a lot of people doesn't have a clue how and what. So I'm thankful that both of you are conscientious and help them in your place. But there I go, talking about me. My husband says I can make everything about me. I just turned that right off of feet onto a mindset in a heartbeat. So let me get back. Do either of you deal with diabetes? Or I think it's interesting to people to know when you go out of a room and you come back, to be as close to them as to do a surgery, or as to put a needle in their foot, or to even touch their feet. Sometimes there's those of us that don't like our feet touched. Mm-hmm. And so when you're that close to them, it's important sometimes that we know. I know we don't have to tell our personal stories, and not everybody's deserved the right. And it's not even a fair thing to do sometimes. But do you deal with diabetes yourselves, or do you know somebody close in that if 1 out of 3 of us deal with diabetes, I'm the one here today, but I'm just wondering how it's impacted you individually. Either of you want to speak to that?
My mother is diabetic. She has been diabetic since I can remember her. And when I did the gene test, I was told 30% chance I will be diabetic at some point in my life. So I relate to that, and I relate to patients in that aspect. And when I was pregnant with my first child, I had gestational diabetes. And I remember how hard it was to keep my blood glucose level down. And I couldn't, relate to that with my patients as well. Again, I always talked about everything is, I don't talk to my patients about, stopping cigarette right away, addiction, again, controlling your diabetes. Everything has to take steps, right? Mm-hmm. So I'm very conscientious about not, dictating patients, you have to do this, you have to do this. It's just, everything is a step process. And yeah, having that background makes me, humbles me, and I can relate to patients in an easier way, for sure.
What about you, Dr. Kurt?
Oh, my mother's side of family, unfortunately, most of her siblings either had or have diabetes. My mom didn't live long enough. Maybe she would have had it as well. But my first experience with seeing a diabetic wound was when I was maybe 11 years old. My mom's oldest sister, she had a gigantic hole in her foot. And that eventually healed. It took several years, I think. But then she got blind. And unfortunately, I have 3 siblings, and my youngest sibling is diabetic. And so it's very, very close to me as well. And one of the most important things, and Dr. Lanier is right, I don't say you have to do anything. I just gently try to nudge them to make them aware of the benefits of small life changes. Because I think if we try to make people change their lives overnight, that's never going to work. Even in the mental health arena, and I'm sure you are aware of that, you just can't make people change everything all at once. It has to be, first of all, it has to be their decision, and it has to be in baby steps until you get to the point where the baby steps become a little bit bigger steps until you're starting to run. And I think, having seen not just family members, but there were people in the village I grew up in my home country of Trinidad. One day I saw them with legs, and the next day they were missing a leg, and it was like, what happened here? Because it was so sudden with one older gentleman that I knew when I was a kid growing up, that I was shocked. And not too long after that, he lost the second leg. Mm-hmm. And then, and unfortunately, the morbidity rate when you lose even one body part increases significantly. So I think, unfortunately, he passed maybe about 6 months after he lost the second leg. But that's how devastating a disease this can be. But it's also, like I said earlier, it's not a death sentence. It's really just about being educated, being supported, because I think support is a big thing, mm-hmm. especially in households, right? One of the sad things with some of my patients is that the people in the house don't support them, in terms of healthy diets, in terms of let's not do soda, or let's, be more conscientious as a team, rather than, or we'll do what we want and you can do what you want. And that's really, really something that we need to work on.
Yeah, I agree with both of you. The amenability of the patient is absolutely paramount. But I also believe more and more, the longer I live, that more people want to do it. They've just not understood what and how. The other thing I admire about both of you is that you know how to stay in your lane. We can Google anything. Used to, I didn't have a Dexcom to tell me what my blood sugar was in the middle of the night when I'm having a low. I didn't have a pump. There was nothing. Dare I say, I peed on a stick. I mean, I didn't have anything. And I watched my grandmother as she aged with type 2. I'm type 1, but she had type 2. And I watched her sit at night and drink from those tiny little glasses, like 2 or 3 ounces of milk with a sleeve of graham cracker. She was trying her best to do what she was told, but they didn't know then that was not good for her. I know better now as to that being my bedtime snack. She didn't know that, and she was doing the best she could, as well as the physicians telling her what to do. But I watched her lose a toe, part of a foot. I watched her go down from that. And I'm so grateful today that we have more knowledge, so patients have better understanding. We know how to help them in the areas that we can, and then we can help them know that their amenability can be higher than it's ever been in any of the ages before. So I'm very, very grateful, and I'm grateful for the two of you. Is there anything that you would like, before we close this out, just a word of encouragement, something that you would say to one patient, somebody you saw this week, that you would tell that to everybody if you could? Tell me something that we can pass along.
I say, if you're diabetic, find that podiatrist near you. It's very important, because those, information, like you said, if we have that information, everybody wants to do the right thing. And that's how you get information, is by knowing about your feet, by knowing about neuropathy, by knowing about your blood glucose level, by somebody encouraging you on every 3 months when you see that person, telling you, oh, you're doing great with your feet. Hey, let's change your shoe. Or how's your A1C? Are you managing it? Are you seeing your primary? You need all that you need a community of people.
Community.
So if you're diabetic, it doesn't matter if you're controlled or not, go find that podiatrist near you and establish care.
Good job. Dr. Kurt?
One of the things that I always tell my patients is that baby steps are important. And it starts with just reducing what you eat and just maybe doing 2 minutes of exercise a day. That's really how it begins. You don't have to go run a marathon. You don't have to because I think too many patients, they see this big mountain and they think they have to climb all of it at once, and not realizing, look, you just take a few steps, and eventually those few steps become more steps. And then, at the end of the day, you have a better understanding of how to manage this disease.
Move and find a foot doctor.
Mm-hmm.
If we don't do anything else this week, if you're not moving, move. If you have not ever seen a podiatrist or haven't seen one in more than a year, find one. If we just do those two things, we will be better. Thank you guys both for taking your time from your busy schedule to join me. And I hope it's not the last time we talk. I want us to have a community where we can offer everything that we know and have, so that others can spread that around, and we don't just get knowledge. It's plentiful. I want us to have understanding. Thank you so much for coming. And you guys get back and see those patients. And right now, I bless you everywhere the soles of your feet trod. May you be blessed today.
Thank you
Thank
so
you.
much.
I receive that.
Yeah.
Bye.
Have a good day.
Nice to meet you. Oh.
Nice to meet you too. Take care.